Greetings. This is the Cancer Interview Podcast, and I'm your host, Bruce Morton. You know, a theme we try to drive home on our interviews with cancer survivors is the importance of early detection. Our guest on this episode was diagnosed with pancreatic cancer, but wasted no time in addressing her diagnosis. She is Ann Shimabukuro of Potomac, Maryland. Hers is a story that can provide inspiration and education. So when you hear Ann talk, please listen. Here she is, Ann Shimabukuro. And Ann, welcome to Cancer Interviews.
Thank you, Bruce. Good to be here. Thanks for having me.
And we start out the same way, all of our interviews. We want to get to know a little bit more about you, your life outside of cancer. So if you would, tell us a bit about yourself, where you're from, what you do for work, and when time allows for fun, what you do for fun.
Okay, sure. Well, I live in Potomac, Maryland, which is right outside of Washington, D.C., and I've been here for more than 20 years, but grew up in New York and New Jersey. I work in the finance area in the hotel industry. So when I was diagnosed, I was working at Marriott's world headquarters in Maryland, and I'm now with PM Hotel Group, which is a management company managing hotels for all brands, including Marriott, Hilton, Hyatt, and others. And I'm married with two children, two daughters, and I love to spend time with them. They're both in college now, and they play lacrosse, so I love watching them play lacrosse.
Now, as to your cancer journey, everybody's cancer journey is preceded by their going from things being normal physically to things being other than normal. For you, when did you first notice that something wasn't quite right?
Well, this started 17 years ago. So it was in the fall of 2005, and I was otherwise healthy. I was young. I was 37 years old. My daughters were toddlers, 1 and 2 years old. And so my life was, very active, taking them to their daycare and weekend activities and things like that. And I started feeling a pain in my side one day, and it was very sudden after I ate. I had been working, so I was at the office, ate lunch, and then I felt a pain on my left side. And the pain was pretty sharp. It lasted the whole rest of the day. And when I woke up the next morning, felt fine. But when I ate, the pain came back. And again, it lasted all day. It was more of a dull pain. But over the next couple of days, it just didn't go away until on the weekend when I was out with my family. We had gone to a show, and walking back to our car in a parking garage, I lagged behind. I was limping. And my husband said, "This is not normal." And when I got home, I was sick. I vomited. So definitely realized that something was wrong. And I didn't even have a primary care physician. So I reached out to my gynecologist, the only doctor I had actually, and kind of made up something to get the appointment. I was pretty sure it was not gynecological, but something related, to GI, since it seemed to hurt more when I ate. But made an appointment, said, I have this ache on my left side, could it be a tubal pregnancy? I was pretty sure it wasn't. But anyway, when got to the doctor, she quickly ruled out that. She said it's too high up in the abdomen to be anything gynecological. But, being an OBGYN, she had a sonogram machine in the office. And so we did a sonogram right then and there, and she saw something small, and she called it a cyst and said, it might be pancreatitis. So she knew it was on the pancreas, and it was very small but visible. So she suggested that I go to a gastroenterologist. So I went to my husband's primary care practice first, saw a general practitioner, and he also recommended seeing the gastroenterologist, the specialist in their practice. So I saw that doctor, and did a couple more scans. I'd already done the sonogram, then did a CT scan and an MRI. And each time they saw something. So finally, the doctor ordered a biopsy. And that's when I kind of got concerned because, at first, my doctor had been calling it a cyst. And this is the first time that it had been called really a potential tumor, right? And I had been researching pancreatitis online. And as I was reading about it, I also read about pancreatic cancer, thinking, oh, good thing I don't have that, right? So it was really nerve-wracking to go in for a biopsy. And we did that at Georgetown University Hospital, which is not far from where I live. So it is a nationally known cancer center, the Lombardi Cancer Institute. So I was lucky to be in an area, with a good hospital. So after the biopsy, the very next day, I got a call from a nurse at the hospital saying, the doctor would like to see you in person. I thought, well, that can't be good, right? So I called my husband and he met me at the hospital. And that's when the doctor said that it was actually a malignant tumor. And he called it an adenocarcinoma, which, I at the time didn't really know what that meant. But he said, we can do surgery. And this was right before Christmas. And we had a trip to Disney planned. So he said, go on your trip. When you come back, we'll do the surgery. And, I was a little concerned about doing it so close to the holiday. I know when I had my first daughter, the doctor said, you don't want to schedule it around the time of the holidays because you might get the B team or the C team if the, head nurses are all on vacation. But we scheduled the surgery for December 22nd, and the doctor said, don't worry, I have another one on the 23rd, so it's not too close to the holidays or anything like that. So, we went on our Disney vacation. I did come back a day early just to do some pre-op work, and then had surgery at Georgetown on December 22nd. I was there for 3 days, and I came home on Christmas Day. So that was the best Christmas ever, being able to come home after successful surgery and spend it with my family.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or a review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon so you'll be notified the next time we release a cancer interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. Now, Anne, I want to get back to what happened before the treatment. A key part of your story is choosing to be proactive at a time in which others might have wanted to ignore the symptoms. What was behind your being proactive?
Mm-hmm. It was the encouragement from my family because I was otherwise healthy. And this was a very unusual episode for me to be in pain for so long and limping and nauseous. So my sister, my husband, both encouraged me to get it checked out. And I think it was also just very fortunate that my doctor, my original doctor, it was not her area of specialty at all. She didn't turn me away. She continued investigating while I was with her and found something. And, after I saw something like that, even though, the pain had actually gone away after a few days, I followed up. And I think it just, knowing that there was something there, I wanted to kind of keep pursuing it. And I have heard from other pancreatic cancer patients that it may take weeks or months to get a proper diagnosis. Pancreatic cancer can have very vague symptoms. And now that I know more about it, I think I had many of them, abdominal pain, back pain, even though my pain started kind of on the left side of the abdomen, kind of wrapped around to my back. And so back pain is also a symptom of pancreatic cancer. And then for more advanced cases, jaundice is another telltale sign.
Let's go back to that twixt and tween zone, post-diagnosis and pre-treatment. Based on what I'm hearing from you, it sounds like you were optimistic heading into treatment. Is that fair to say?
Yes. Well, the very first day, it was just overwhelming. I was just emotionally a wreck, thinking about what could happen, with my 2 young children. And really, fortunately, it only lasted a day, or I only gave myself, 1 day or 1 night to be really upset about it. But the doctor was very optimistic. He said, it's a small tumor. It's located in a place where we can just remove a portion of the pancreas. And they remove the bottom third, or the tail of the pancreas. And he, I think, helped me get comfortable with it. And, based on his optimism, I felt better also. I had also asked the gastroenterologist I had been to before about this doctor, because I had been referred actually to a different gentleman, and Georgetown put me in touch with this particular surgeon because he was a pancreas specialist. And so even though he wasn't the name that my gastroenterologist had recommended, I felt very comfortable knowing that this was a doctor who had specialized in pancreatic cancer and did numerous surgeries at a well-respected hospital. And so that gave me a lot of confidence also.
You have addressed the emotional side of going through treatment, but as for the treatment itself, which you briefly referenced, but if we could circle back to that, the treatment from a physical perspective, what was the toughest part?
I think recovering from the surgery itself. You have to get sliced open. And so I had a lot of abdominal pain. I was only in the hospital for 3 days, and they encourage you to walk around, just to begin the healing process. But even when I left the hospital, I was very sore and tender. The nurses had given me a little pillow, so I would kind of clutch it around my stomach, even and brought it home. And so I just moved around very slowly. So after I got home, was just kind of laid up on the couch for a while, and just, was home for a week from work. It was the Christmas week anyway. But just, I wasn't used to being kind of, cooped up like that. And then with 2 little kids at home, I wanted to just give them a huge hug and lift them up when I got home, but I had to be very careful. So that was difficult. But, after a couple of weeks, I probably felt back to normal. I do remember my surgery was on December 22nd and went home on Christmas Day, December 25th. My daughter's birthday is January 2nd, and we had a birthday party planned for her. So we went ahead with that, and I think people could tell that I was, not moving very quickly. And I do remember a friend of mine, one of the party guests even telling me to sit down, but of course I wanted to be, the hostess. But it actually helped me having so much family around and having things to do. So I went back to work as quickly as I could, which was about a week later.
Now, you mentioned the family as a whole. Would you say that your family, it was sort of a group effort in terms of a source of support for you?
Definitely, definitely. I'm really fortunate to have my parents and my sister live nearby. And I mentioned that my sister and my husband were the ones who encouraged me to seek treatment to begin with. And then everyone was so helpful, having them around. Definitely a source of support.
Now, at what point, can you look back and say, well, at this juncture, I felt like I was starting to get the upper hand on pancreatic cancer?
Pretty soon, actually. After the surgery, the doctor said it was successful. There were clean margins, so no evidence of spread. And I was, starting to feel better. However, my doctors had more treatment in store for me, which they didn't tell me about in the beginning. And I'm not sure if it was because they wanted me to just focus on one step at a time, or maybe even because, unfortunately, some pancreatic cancer patients don't make it that far. But after my surgery, about 6 weeks later, I started chemotherapy, and that was another 3 months where I went in once a week. I would go in on Fridays for a couple of hour infusion for chemo. And then after that was done, once again, I was surprised with another step of treatment that the doctors hadn't told me about, and they recommended radiation. And it was actually presented as a choice. Like, do you want to do the radiation or not? And I thought, well, if they're going to recommend it, I'm going to do it, right? I don't want to not do it and later regret it. So then after the chemo 3 months, did 5 weeks of radiation, and that was not bad. I mean, the chemo, I had mild side effects, mainly fatigue. So I would have the chemo on Fridays and then just rest for the weekend and then go back to work and continue with life on Monday and then go back again for treatment on Friday. With radiation, it was pretty quick and easy, I would say. I was very fortunate. It lasted about 60 seconds. So it took longer to, drive to the hospital, get changed into the gown, and then drive home. The radiation itself, which is lying there, is almost like, getting an X-ray or a scan. I was a little nauseous after the first time. And so when I told the doctor that, they prescribed an anti-nausea medication, which I took beforehand, and then it was not a problem. So after 5 weeks of radiation, once again, I thought I was done with the treatment, and I was feeling pretty good the whole time. And then the doctor said, well, just to be on the safe side, he prescribed an oral form of chemo, a pill that I would take, morning and night. And that was easy to do. I didn't have to drive to the hospital. It's easy to take a pill. And it actually gave me a lot of comfort or peace of mind that in the event there was anything coming back, this pill would take care of it. So I ended up taking the oral form of chemo for another 2.5 years. And then the doctor said, we don't have long-term studies about this drug because you've made it longer than most patients. And so continuing the chemo might do you more harm than good. So I stopped taking it reluctantly because I was finding a lot of comfort actually in taking a pretty easy form of chemo. But we stopped taking the pill, and then I was just getting scanned regularly. So at first it was once a month doing a CT scan, then we lengthened the time in between to every 3 months, then every 6 months, then once a year, and then eventually stopped altogether. So it was, kind of a gradual end to the treatment, but I just feel so fortunate. And like you said, catching it early was really the key factor there. Most people with pancreatic cancer don't catch it, unfortunately, until it's spread, until they're already jaundiced or feeling pain in other parts of the body. So in my case, I think I was just so lucky that where the tumor was, it hurt when I ate. And it was, very obvious to me that there was something wrong. I think in many cases, the symptoms are so vague that they can be confused as pancreatitis or indigestion or something else. So I was just so fortunate that it was located in a place that caused me such pain that it kind of prompted me to get it looked at.
I want to talk about your experience with chemo because there are certain things that unfortunately are part of the territory when somebody undergoes chemotherapy. First of all, did you have any sort of problem with the taste of food?
Actually, no. The drug I was on was called Gemcitabine or Gemzar. And back then, I think that was the standard of treatment. It's been 17 years. Now they use that in combination with another drug, and they presented as a cocktail of two drugs together, which I've heard, is much harder on the body. So I did not really have any change in taste. I also didn't lose my hair. I had been worried about that. And it was really just fatigue, so after chemo, I would fall asleep on the way home in the car and then just rest for a couple of days afterwards.
One other thing, because you've already answered my question about the hair loss, and I'm glad that was not a component in your chemo experience, but did you have any cognitive issues?
I did not notice, people say that you could have like a chemo brain or a chemo fog. I can't say, or maybe I did and I've forgotten already, but it didn't, if I did, I don't think it was particularly bad.
Now, once you got to a point in which it looked like the worst was behind you, how exciting was that? How gratified were you?
I guess it didn't feel like, there was like a moment. And also, I think that all during treatment, I was just trying to continue my normal life, right? I continued working. I have a lot of people who ask me about that, like, why didn't you take time off? And I thought, well, what am I going to do sitting around at home? I only go in for chemo once a week. And I felt like I wanted to keep my life as normal as possible. The other thing that really helped was really the family needs. I had two very young children, 1 and 2 years old. And so I had to continue being their mom and helping care for them. So I think that I just continued my normal life as much as I could the whole time.
Our guest is Ann Shimabukuro of Potomac, Maryland. She's a survivor of pancreatic cancer. We had talked just a bit ago, Ann, about support and how there was plenty within your four walls. But outside of your four walls, an outfit that is national in scope is the Pancreatic Cancer Action Network. To what degree has it been of assistance to you, perhaps post-treatment?
I didn't discover PanCan or I wasn't active in it until years after my diagnosis. I did find out about PanCan early on because my oncologist at Georgetown said, you'll probably go online. There's a lot of good or bad information out there, but he recommended PanCan's website as a reliable source of information. So I did go there, looked around. I put my name on their mailing list, so I would get emails from them. And it wasn't really until about 3 or 4 years after my initial diagnosis that someone reached out to me. She said she was organizing a 5K fundraising walk for PanCan. And it would be the first time that they were doing this in Washington, D.C., and asked if she could interview me for a story and if I could help as a volunteer. So I, of course, said yes, and I was interviewed by her. And then I said, well, I could maybe help, to some extent, because I'm still working full time. I'm pretty busy, but I was working at Marriott, and I said maybe some of my hotel or food and beverage connections would be helpful. So I started working on the planning of this 5K, and that was really great, actually, becoming more involved with the pancreatic cancer community. I met other survivors. Most of the people I met had lost loved ones to pancreatic cancer. But there were other survivors and other long-term survivors that I met. And so we've now done the Purple Stride 5K. This is, I think, our 13th or 14th year doing it. And I see some of the same survivors there year after year, and that's wonderful. And I always try to spend time at the survivor tent there to be able to talk to the new survivors, the people who are newly diagnosed, so that they can see, oh, there are people who survived this and who can be, 17-year survivors. So it's actually been, a blessing for me. I feel so fortunate, and I want to give back. And I think that just being around, I guess, provides hope for people that, okay, there are people who make it through this, through the treatment, and can live a normal life afterwards.
And one other question about PanCan. As you mentioned, you didn't become involved with it until you were about 3 or 4 years out from your treatment. But what about the person who's just been diagnosed, or they fear they might be diagnosed?
Mm-hmm.
What are some of the services, some of the information that PanCan can provide?
Well, they have a great service called Patient Central, basically like an 800 number where you can call to get information from a caseworker. And these caseworkers will, stay with you or your family throughout. So if you need to call back for more information, you can speak to the same person. But they can give information about clinical trials. That's something that I didn't know about. And now I know that, if a patient has a particular genetic marker or something like that, they can get personalized treatment. They can get immunotherapy. They can be in clinical trials. There are many, many services in addition to, helping with things like nutrition, insurance questions, genetic testing. They're really a great resource. So I would encourage anyone who's newly diagnosed or family member of someone who's been diagnosed to contact PanCan Patient Central.
And that website is PanCan, PANCAN.org. Very easy to remember. And that's where you can go to get a wealth of information on dealing with the pancreatic cancer journey at any possible stage. All right, and it's our time now to sort of wrap things up. And whereas we begin our interviews from the same place, we try to close them from the same place. And to some degree, you've already covered the area that I'm going to bring up, but we might be a little bit redundant, but that's okay. And that is that if you were to encounter somebody one-on-one, have a private audience with somebody who has just been diagnosed with pancreatic cancer, or they found out they could be a candidate for pancreatic cancer, especially with what you've done in being proactive, what would your message be to that person?
Well, I would say, listen to your body, right? If something does not feel normal, get it checked out. Get it checked out. And preferably, bring a friend or a relative to the appointment, because you might have so many emotions or thoughts. It's helpful to have someone else there with you who can maybe take notes, and you can compare kind of what you heard afterwards. So that's one thing. The other is, there is a lot of information online, and the statistics about pancreatic cancer can be very scary. The 5-year survival rate when I was first diagnosed was only 6%. And now it's increased, but it's still only 12%. So those statistics can be very daunting. But I would say you are not a statistic, right? The only patient who matters to you is you. And so the fact that only 12% of the people may survive 5 years, well, it doesn't matter. What matters is your own case. And so I would encourage you to get anything checked out, go see the doctor, get a second opinion, call PanCan with questions, and they may be able to suggest some treatment alternatives or clinical trial. So there are many options out there. So there's always hope.
Excellent. And thank you so much for sharing your story, both in terms of the past and in terms of the present. We had mentioned the words early on, education and inspiration, and you've checked both boxes in a major way. So, and thanks very much for sharing your time with us, and Shimabukuro of Potomac, Maryland. And thanks for being with us on Cancer Interviews.
Thank you, Bruce.
And we want to remind you one more time that anytime that you are on a cancer interview, you're not alone. There are plenty of people out there, just like Anne, who have information that can help you or a loved one on their particular cancer journey. So until next time, we'll see you on down the road.